Hi, my name is Miranda Pullen, and today we are talking about malaria in Sub-Saharan Africa. The purpose of this presentation is to examine both the direct and indirect effects of malaria on health in Sub-Saharan Africa. The objectives include describing the health effects of malaria and why it's a public health problem, identifying why malaria is concentrated in Sub-Saharan Africa, explaining the relationship between malaria cases and deaths, listing the direct health effects of malaria, recognizing the relationship between malaria and sickle cell anemia, evaluating the burden of each disease in relation to the other, and identifying the indirect health effects of malaria resistance. Here is our table of contents for today's presentation. So malaria is caused by bites from the Anopheles mosquitoes and causes a host of symptoms like impaired consciousness, headache and fever, difficulty breathing, dark or bloody urine, jaundice, and extreme exhaustion. The top graph shows malaria cases in millions. In 2011, we see a slight dip, however, cases have rebounded since then, and overall, cases have more or less stayed consistent. Deaths are shown in thousands and have consistently decreased since 2000, with an uptick in cases during COVID. This shows that deaths are decreasing because of better medical care and better mosquito prevention, but cases haven't changed. So it's still a consistent health problem in this region. This is an example of malaria prevention. So these are mosquito nets that hang over beds so that it can prevent people being bitten when they're sleeping. And this is the percentage of households with insecticide-treated nets in Sub-Saharan Africa. So in 2021, we see that 68% of households had at least one net, up from just 5% in 2000. So they've made a lot of progress. This is a map of malaria transmission. So we can see that there is some transmission in South America and Asia, but most of it is concentrated in Africa, where 95% of malaria cases were in 2021, as well as 96% of deaths. So the World Health Organization African region takes on the brunt of malaria worldwide. So why Sub-Saharan Africa? Well, the answer is pretty simple. It's hot and it's wet. This creates the perfect breeding ground for Anopheles mosquitoes, and they multiply rapidly. So obviously, malaria is not a good disease to have, and it can make you quite sick and potentially lead to lifelong complications and death. It's also bad for the healthcare system because malaria treatment is expensive and also hard to get in the Sub-Saharan Africa region. These are the direct effects of malaria. On the flip side, however, the indirect effects are actually malaria resistance, and we'll get into why that is. So here's a map again of malaria cases. Pay attention to where the dark orange region is. And here is a map of sickle cell anemia prevalence. If we look at these two maps together, we see that sickle cell anemia occurs exactly in the same region as malaria, and now we're going to talk about why that is. So first of all, let's talk about what sickle cell anemia is. This is a normal red blood cell, and this is a sickled red blood cell. Sickled cells cannot bind iron the same way as normal cells do, and they also can't move through the bloodstream properly. This causes pain, swelling, iron deficiency, vision problems, and persistent infections. This is an image from a microscope showing a sickled cell, as shown by the arrow, surrounded by normal red blood cells. When we look at the genetic tree of sickle cell anemia, we see that it is a recessive disorder, meaning that only people with 2 copies actually develop the disease. However, in those people with only 1 copy, they become carriers and they have malaria resistance. So again, if we have a look at these two maps, we can see together that malaria and sickle cell anemia occur in the exact same spots of Sub-Saharan Africa. And this is because being a carrier for sickle cell anemia gives you malaria resistance. So what we have is people that have not been infected with or succumbed to malaria, most likely being carriers of sickle cell anemia, yielding a population with a very high carrier percentage. Those carriers get together and have children, of which 25% have 2 copies of the gene and therefore develop sickle cell anemia, and 50% that have 1 copy and become carriers. And around we go. People who have survived long enough to have children are likely malaria-resistant sickle cell anemia carriers. This will continue to drive a population of high sickle cell anemia prevalence. Sickle cell anemia has very little treatment, and especially in Sub-Saharan Africa, the treatment that does exist is not able to be utilized. People with this disease will have pain and suffering for most of their lives, and there's a huge burden on the healthcare system because of the extra treatment that these patients need. But malaria also has little treatment, also has pain and suffering for patients, and also places a burden on the healthcare system. So what we get is this double burden. The health systems in Sub-Saharan Africa are dealing with both malaria infection and malaria resistance, leading to sickle cell anemia, and they essentially cause the same problems in the health system. So where do we go from here? The first is vaccination. The malaria vaccine is quite new and will take a long time to effectively distribute, but it will help to ensure that people without the sickle cell gene can live long enough to have children. The next is improving the healthcare system to better be able to handle the malaria and sickle cell needs. This is data pulled from the phase 3 trial of the malaria vaccine. In infants 6 to 12 weeks, we see a protective efficacy of 27%. In children 5 to 17 months, the efficacy jumps to 45%. Malaria and sickle cell anemia will likely always be tied together in this region. Genetic pools take hundreds of years to develop and change, but hopefully with the distribution of malaria vaccinations, we can ease the sickle cell cases. And here is a summary from our presentation today about malaria and sickle cell anemia in Sub-Saharan Africa. Thank you so much for listening.